Hey everybody, welcome to the exciting world of tendinopathies, or what we refer to as tendinitis, or most known now as tendinosis. I am Doc Hockey, Shane Bales for ProAction Health and Performance, and we are located at 308 Palladium Drive. You can reach us at 613-505-5000 or at proactionsportsclinic@gmail.com. So what is a tendinopathy? So most common diagnosis from certain doctors or other healthcare practitioners you might have heard of: tennis elbow, golfer's elbow, plantar fasciitis or fasciosis, Achilles tendinosis, hamstring tendinosis, trigger finger or thumb, and shoulder rotator cuff tendon injuries such as supraspinatus tendinosis. They all are slightly different, but we'll go through some of these conditions as we go through the presentation. We can answer some of those questions and help you be more comfortable with these types of injuries and what you can do. So what kinds of cells are present in this type of injury of tendinosis? Well, they're often non-inflammatory cells. They resemble cells in like scar tissue adhesion or fibrosis that you would find normally in muscles. They just look different because they're in tendons. The fibroblasts create this type of tissue, which is like a fibrous tissue, and it's from a cycle of hypoxic in a hypoxic environment, which is a non-oxygenated environment. So fibrosis actually is a better source of tissue because it doesn't need as much oxygen as normal ligaments and muscles might need. Now, the three causes of tendinosis or tendinopathies is long-standing posture. So if you sit at a desk all day, those postures restrict the oxygen that is into those muscles and the muscles that are being contracted. Repetitive motion, like skating, typing, running, anything that you do in a repetitive period activity that might create more contraction of the muscles that, obviously close off the blood supply to those areas. Trauma, so car accidents, falling down onto your hip or whatever. I know for me, I play hockey a lot, so I have really tender hips. So if I fall on my hip, it really hurts because of the trauma that have happened over and over again from just, playing and falling, and it becomes extra sensitive. Tendons and ligaments are thickened and weak, just like the muscles are in the muscle belly. They get thickened and they're weak, so they're actually, wider and things like that, and you can feel them when you're palpating them. So as you look up here, we have a pre-injury. So this is really healthy tissue, right? Nice and smooth, and that's what it kind of looks like. As you injure it, there becomes little breaks in the muscle tissue, and there's a little bit of swelling, and the tissue isn't as fluid and smooth anymore. And as it heals in that fibrous tissue, you can see there's a lot less red, there's more white, which explains why there's less circulation in that area. So scar tissue is present. You have an increase of re-injury rate when it gets injured, obviously, because it's not as strong. And once the fibrous goes in there, you're going to get a decreased range of motion, decrease of contraction, so the stability isn't there, and it's just a less functional muscle or tissue like in the ligament or tendon. Here's just a look at it underneath a microscope. So you can see this is a nice healthy tendon. This is a patellar tendon. So it's off your patella, which is your kneecap. So this is nice and elongated. You can see the yellow things. They're nicely packed. As you can see over here, they're not as nicely packed. This is after post-surgical, and you can see some of the loss of the cartilage in through here because this is not cartilage, collagen, which is the muscle kind of fibers, or in tendons, it is the tendon fibers or ligaments. And you can see how they're kind of broken down. The smaller things are more like a grittiness. They're smaller. They're not the elongated, smooth muscle that you'll see in the other ones that we can see before. And this tissue is weaker and just more of that scarring, like when you feel in your skin, after you have a scar, it's kind of rough. It kind of bows outwards because it's thickened, and it's just not as pliable or elastic. So epicondylitis, tennis or golfer's elbow. So tennis elbow is usually on the outside part here. So where they get tennis from is because when you serve, you extend the arm backwards and you go back. So it's that extension part that gets the outside part of the elbow. We're looking at golfers. So golfers are coming in here and you're hitting it there. When you hit a chip shot or whatever, and you hit that, the chunk, the shot, you get a lot of pressure into that inside part of it because it jars the muscle, pulls in the tendon, can make little micro tears into that as well. So you have a little bit of a problem with that. Okay. This is the type of thing that we want to look at when it looks at treatment. We want to use active release technique or ART when we're doing that. That breaks down a lot of scar tissue or fibrosis in the muscle tissue. In the shockwave therapy, it works a lot better for tendons and ligaments because it gets in there, stretches it really, really well quickly. And the active release is kind of a slower stretch. So unless it's kind of fresher or in the muscle, sometimes it doesn't get broken down as well as a shockwave treatment can do. We also use Graston because it's a little bit more invasive. Those are the instruments that we use, like the metal instruments we go along tissue. You can really pick up the fine, fibrous little nodules that are in scar tissue, especially in ligaments and tendons when we're doing that with the Graston tools. That's why they work really well. Each tool has its kind of niche or sweet spot treatment. And then we use the laser afterwards to get that healing back. So the healing helps heal up that tissue a little bit faster after we've created some inflammation in that area to create more healing in the area. And we have specific exercise a lot of times to do that to create the tensions that you need. When you create tensions into a muscle, just like after post-surgical, you're creating fibers to heal in the direction of the tension or the pulling. And that's why treatment is expected to be along those fibers and the direction of those fibers. We often can use acupuncture as well because that usually helps it with the nerve that goes along with it. So exciting the nerve to go through there and not creating a pain cycle of neurogenic inflammation is important. And that's why we use that as well if it is indicated into the condition of the patient. Recovery time is usually 6 to 12 weeks with proper treatment and rest. This is where people get in trouble with tendons. A lot of times we treat tendons too often. If you treat it too often, it stays inflamed, it stays sore, and it doesn't have that chance to actually heal itself because they don't have that circulation. They're not like muscle tissue. They keep getting injured. If you treat it too often. Same thing with strength. We often strength training for grip strength. You don't want to train that often more than once a week because the grip strength doesn't recover as much. And then you end up having to get weaker grip strength rather than improving it and strengthening it. So it's really important to have the right diagnosis and the right time of recovery for everybody. And sometimes people recover a little bit slower than others. So you got to make it an independent treatment plan for each individual patient. Achilles tendinosis. I've personally had this as well. It's an overuse, often in runners, can be caused by improper footwear, tight calves and muscles, because the tight calves go from the muscle tissue and the muscles there into the tendon where they all meet it, which is the Achilles tendon. And I'm sure one of us have definitely had a person who's had a ruptured Achilles tendon from work, jumping, sports, all that. We're hearing more and more on the news. Aaron Rodgers, different people that have the Achilles tendon that ruptures that go on through there. I think who's the other one? Kirk Cousins, he had one, and you're just hearing it all over the place with these guys that are overstressing them, overactivity, and everything. Symptoms: stiffness, pain in the back of the ankle, especially in the morning. That's what it usually does. It warms up after you kind of walk on it. It feels better because there's more circulation going to it as it gets pumped and it gets stretched, so it feels a little bit better. Treatment, we're still using the Graston, the Shockwave, the active release technique, the laser, acupuncture, and specific exercise. We use an eccentric exercise or on a step. We go down with the 1 foot, come back with 2, go down again on the step with 1 foot, and that's an eccentric contraction, which really helps establish tensions along the Achilles to help create more collagen in the area to make it stronger and to lengthen it out. It's a great stretch where the heel kind of falls below the step. We do that, but it has to be at the right time. We often do a static stretch, then maybe do some concentrics and then eccentric to go through that. Some people can start right on eccentrics, but a lot of times we have to progress into that exercise pattern to make sure that they're doing it properly and it's not overloading the tissue and creating more inflammation. Recovery time, 3 to 6 months, is depending on severity. So depending on how far along your Achilles tendinosis can be, it can be shorter or it can be longer depending on how much is there. Often it takes longer to kind of get this stuff going, but it often is a good thing to make sure we're managing it properly and tell the patient it can take a little bit of time because sometimes people often get impatient and want to see results quickly. And sometimes that's not the case. And we don't want them to give up on it because Achilles ruptures are you're looking at a year for recovery, and that's just to get it back and functioning. And then if you're a sports or an athlete activity, go back to the performance that you're at. That's another year on top of it, and you'll see that with the different athletes that have to recover from these types of injuries. Now, as you can see, the bottom says my marathon story. Now, I've had Achilles tendinosis before. I trained for a marathon. It kind of got worse as I was doing that. I could feel it every morning. And my mom was really scared too about me running in this because she's like, I don't want you to rupture it. I don't want you to have a further injury. I'm like, Don't worry, I'm going to take it nice and slowly because all I cared about was finishing it from all the training that I had done. But I did knowing the biomechanics of the foot and how to basically deload the area that was injured because it's usually the inside part of the Achilles tendon that gets thickened. So as you know, there's a water basically on roads, they have the slanted road, so the water drains off quickly. Now, if you're on the one side of the road, it'll slant this way. So it was my right foot, so being on, if the road is like this, it's usually slanted from the middle and outwards. If I was on the right side of the road and I was riding on that, it would bend my foot this way, which took pressure off the inside part of my Achilles tendon, which is where the injury kind of was, the weakened tissue, and that would give me a little bit less load on it so it wouldn't have that high stress. I also took it slow, and I took 5 minutes of running, 1 minute of walking, 5 minutes of running, and I kept doing that until it kind of warmed up and got better, and I could feel the tension in the Achilles uh, dissipate, and then I was able to kind of go more full length and strides and cut down sometimes on my walk to run ratios, and it really helped me out. I finished the marathon with no extra injury, and I did fairly well and completed it, and that was my goal overall. So it's really important to have those proper footwear, proper biomechanics, and just proper training purposes, as well as daily activities of daily living. Plantar fasciosis or plantar fasciitis that people have often heard about. These things are, really a more of a tendon kind of issue, not a foot muscle issue. And they can be very tough because we walk every day and it's hard to kind of get away from it and get the proper rest. Overuse, arch support is important. So poor arch support basically can put a little extra pressure on the tendon that keeps pulling on the tendon where it attaches to the bone, creating this tendinosis or fasciosis. And excessive standing, walking, hard surfaces, foot strength, and toe movements are also important to create more of a flexibility into the tissue and make it more elastic rather than fibrosis or fibrotic. Symptoms: sharp heel pain. It's usually in the front part of the heel, a little bit off into the middle. It's worse in the morning. And you can also have different Achilles points in the back of the heel where you can see like a heel spur, which you can see kind of down here as well, where they're kind of positioning it. So it can be a little bit different, but usually the plantar fasciosis is right in through here that people feel on the heel. We use, like we said, laser therapy, shockwave therapy, ART, stretching protocols for the foot, and foot drills to help get the foot strength and stability in all ranges. And the toe exercises are really good to help separate the tissues in there from doing your big toe and small toe, moving them independently by themselves. Especially for those people that play hockey or skiing, it often is um, different because they're in these hard boots and they don't need to use your toes. So the body often tells you that it's not an important skill to have to move toes independently. And we know that it is for foot stability and for good tissue health. So the recovery here is 2 to 6 months with consistent treatment and proper treatment, the proper rest and proper guidelines and modalities like shockwave and ART and things. Hamstring tendinosis, this might be one of the hardest tendinoses to get rid of just because of where it's positioned and how deep it is. Over here, the glute max kind of goes across here and the tendon sits right underneath here and it usually goes down to like where your sit bone is over here. So it's really hard sometimes to get into that tissue and really hit that tissue properly with often the shockwave that we're using. And also the tissue tendons in that area, they kind of go, if you can see my thing, the glute max goes this way and the tendon for the hamstring goes this way. So when you have to go through tissues that are in different directions, it's harder to get to that tissue and penetrate it with the direction that you want because of the overlying muscle tissue that is in there. You often see this with repetitive sprinting, improper warm-up, muscle imbalances, and prolonged and consistent sitting because when you sit on something, you decrease the oxygen that's in there from the circulation, and it creates more of a tendinosis in that area. Symptoms: deep pain in the sit bone, in the buttocks, or in the back of the thigh is often felt. We use the shockwave number one for this usually, and then we use the different things to get into that if we need to use some dry needling, some acupuncture, targeted strengthening and stretching, which is a very unique kind of hamstring stretch. Usually we're using an eccentric contraction with contraction as well. So it's like really putting extra load on that hamstring with the foot up on the table. So it's one of those things we can show if you'd like to know further about the hamstring tendinosis if you're actually suffering from it. It's another one that's like, can be 2 to 6 months depending on severity and the practitioner that you are seeing. Trigger finger and thumb. This is usually caused by manual labor, weightlifting, or genetics. It's a different kind of tendon a lot of times than the tendinosis we've been talking about. You can see here that there's a nodule that goes right through the thumb here. There's little sheaths, or they call it A1 pulley. There's an A2 pulley up here, and this nodule gets stuck on that. So it often clicks back and forth, and I'll show you a little video on that. And so it kind of like, and they call it trigger finger because often it gets stuck here and you can't get it. You're always on the trigger, right? And then pow, it goes through and it pops open and close. It can be very painful. It can have different severities because as it gets bigger and bigger, then it's where you get the trigger finger. You can't even open it up, and that can become quite a problem for a lot of people and painful. We use the Graston and the active release as well as Shockwave to get rid of this nodule. And when we're doing it, we often have to get it early on. If we don't get it early on, a lot of times we're not going to be able to make a lot of differences with the nodule because it's so progressed and it's so thick that it can't get through that. And then surgical is the next option to get that. Just either they cut the sheath or they have to do something to the nodule, which can create scar tissue and make more problems with it later on. But at the same time, it's sometimes what the best recommendation that you have at that time or treatment for it. Depending on the early treatment, we need to see in 2 weeks it can be resolved, or it can take up to 2 months for extreme circumstances. And like we said, surgeries are kind of last resort. So here's a little case study that I did in my clinic with the trigger thumb. So take a look.
Okay, so just flex that back and forth, nice and slow. You can see how it has that little bit of a jaggedness. It goes pop, pop, right there and there. Okay, good. So when we're looking at trigger thumb, you'll see the tendon of the flexor pollicis longus that goes into the carpal tunnel, up through the thenar muscles, through the first joint in the thumb, and then the second joint in the thumb. The boxes represent the sheath that goes around them, and that's often where you'll become frictioned and you'll create nodules and little nodules that get stuck in the sheath and then they pop open. So when you get triggered them, it's like. Now the most common area is A1 with pulley system, and that's that sheath that goes underneath. So when that nodule gets bigger, it gets stuck at that A1 sheath, and then you have to really pull for it to go through it, and you get that kind of that jar or that jagged trigger that goes through as well. So we know that if we treat it early on, we can decrease that nodule so it fits better into the sheath and it goes through smoothly. If we wait too long, sometimes it has to be a surgical procedure that is there to reduce that, especially if it gets locked and you can't move it up. So you can't move the thumb and you can't unlock it, and that can be quite uncomfortable, can create inflammation and pain. You're clicking thumb, go ahead. It's actually a little bit at the end there. Not too bad though. A lot better than it was clicking before.
Yeah, I was gonna say, I don't feel any flex right now.
All right, guys. So I hope you saw that. It's much smoother after that. The clicking had gone with that, and that was after a couple treatments. We were really happy with the progression that he had for his trigger thumb, but he got in early when he just started feeling it. So I recommend doing that. Don't wait too long because it can be something that can progress pretty quickly. So why choose ProAction Health and Performance for your problems or tendinosis anyway? We're expert therapists. We specialize in removal of scar tissue, which a lot of people don't do. That's our main focus because it really helps out with a lot of conditions to get better. Probably 90% of things can be helped by breaking down scar tissue. We do the rehabilitation. We work with occupational injuries as well. We're advanced technology. Not a lot of people have the class 4 laser therapy, which is a great healing tool, especially after you beat up the tissue or after people have had damaged tissue. The shockwave therapy, you need that for a lot of these tendons to get them better, especially the bad ones that have been there for a while. Acupuncture, we use electrical stim, we use dry needling, we use a lot of different techniques for our acupuncture, which really help out for those tough cases as well. Comprehensive care, we're hands-on treatment like Graston, ART, and are very effective for fibrosis and nerve entrapments, which we see constantly that come into our clinic. We're personalized treatment and rehab programs that are tailored to the injury and your lifestyle, not just what we just use every day, and it's our favorite tool. So we try to be specific to everybody and make sure that the condition fits our programs and our treatments, so they are different for everybody. So if you like what we said today, book your consultation today. Maybe you can help a friend, maybe tell a friend, maybe yourself needs it. So come and see us. We're at 308 Palladium Drive in Canada, Ontario. 613-505-5000, our phone number. ProAction's Sports Clinic at gmail.com. You can reach us at. Our website is www.proactionsportsclinic.com. We're ProAction Health and Performance. Thanks for everything. If you have any questions, let us know. We see results, so why shouldn't you? Take care, guys, and until next time.